Thanks very much. Now, I think as you already understand, I'm really keen for this to be interactive. So if there's anything I'm saying that you don't understand, don't feel inhibited about asking it. If you think I'm talking too simply, tell me, and I might ask you some questions as well, just to sort of see exactly what you want to try and find out about this. So the title of this talk is National Screening for Bowel Cancer, from Idea to Reality. And the first thing to say about bowel cancer screening is it's really a misnomer, because the bowel, of course, refers to the whole of the gastrointestinal tract. And what we're doing with bowel cancer screening is screening for cancer of the large intestine, so the colon and the rectum. But when we were at the very early stage trying to name this programme across the UK, it was felt that colorectal screening was a bit too impersonal, and perhaps some people might not really understand what it was about. I think it's still actually, some people find it quite difficult to understand what it's about, and that's really what this event is about. So my plan is to, over the next hour or so, with questions and interactions, to try to trace the development of colorectal or bowel cancer screening in the United Kingdom from the very beginnings to where we are now, and also to try to give you some idea of where it may be going in the future, because although it works, it's a very imperfect process, and I want to bring that out. I want to try to let you have some insight into how we might improve the process in the future. But first, I think it's important that I say a little bit about the disease itself, so bowel cancer or colorectal cancer. So how important is it? Well, in the United Kingdom, it's currently the second most common cause of death from cancer after lung cancer. In women, breast cancer is a bit more common. In men, prostate cancer is a bit more common, but as bowel cancer affects both men and women put together, it is the second most common cause of cancer death. And this is true worldwide. And what we're seeing is that in many countries across the world where bowel cancer was very rare before, the incidence is rocketing. For example, in China, in Taiwan, in Japan, in a lot of Far Eastern countries, the incidence of colorectal cancer is going up and up and up, just as the incidence of stomach cancer is coming down. And we'll come on to some of the reasons for why that might be in a little while.
Sorry, did you say one cancer was going down?
Sorry? Stomach cancer. Stomach cancer. So, how common is it? So, in Scotland, if we just confine ourselves to Scotland, there are about 3,500 people getting a diagnosis of colorectal cancer each year, and about 1,700 people die as a direct result of colorectal cancer each year. The total population, all of us in this room in general, have a 1 in 30 chance of getting the disease, and it accounts for about 3% of all deaths across the whole spectrum of mortality. So that's just to give you an idea of the scope of the disease or the extent of the disease.